Oh, when traveling this summer, the last thing you want to have happen is some kind of health emergency. You can't be prepared for everything, but you can be prepared for most medical issues.
Yeah, and joining us now with her list of healthy essentials to pack for travel is Dr. Dina. Thank you for being here.
Thank you so much for having me.
All right, so Dr. Dina, most people know to pack their prescription medications, but what else do you think that people should be packing when they're getting ready to travel?
So when you're thinking of your prescription medications, you shouldn't just be thinking about packing them. You should be looking to make sure that they're not expired and make sure that you have enough for the rest of your trip as well. When I'm traveling, I often look to see if I need antibiotics as well. You know, I don't know if you've ever been in that situation where you've been to a place and had something like traveler's diarrhea, but it can be horrible. And to be able to just get some antibiotics can quickly treat that infection and get your trip to a good start.
I mean, it really should have kind of a, checklist is the best word for it, to remember to do all these things. Other medical supplies you should pack along with those.
So it's really personalized and depends on you. So if somebody has severe allergies, for example, taking an EpiPen can be really important. And depending on how long your trip is, you may want to even take a backup EpiPen as well. If you have a medical alert bracelet or you have a medical piece of jewelry, it's important to wear that on vacation because that will alert any health provider that there is something wrong and they need to provide you with the right medical support. If you have diabetes, there's a whole list of things that you need to remember taking with you as well.
Okay, so what about over-the-counter drugs? Can they be hard to find in other regions?
Yeah, especially if you're traveling outside of the United States. Things are under different names. It can be really confusing. So it's important to try to pack here and pack right. So I always recommend packing things like an anti-diarrheal medication, something like Imodium, especially if you're traveling to a place where water may not be something that you want to drink. And if you have contaminated water, that can lead to a problem. So something like that would be really important. If you're traveling during cold and flu season, sometimes cold and flu remedies like a Dayquil or a NyQuil or their equivalents will be important. And I always pack some NSAIDs in case of any pain or fever, things like Tylenol or ibuprofen, for example, really important. If you're planning on going on a cruise and on a bumpy trip on the water and you're seasick like me, I get seasick quite often.
Or turbulence sick.
Absolutely.
Ooh.
Important to think about taking those anti-motion sickness meds as well. That scopolamine patch has saved me many times on long cruises.
I'm sure it has. So as a doctor, is there anything else that you put in your first aid travel kit that's important for us to know about?
Yeah.
I feel like bringing you would be a good thing, right? Just so you know what you're dealing
with you guys. Really important for me, hydrocortisone cream.
Ooh, okay.
So I just buy the over-counter hydrocortisone cream that's about 1% topical cream. And then I pack up ointment, like a Neosporin ointment or a bacitracin ointment, just to treat wounds. I have little kids, so they're always scraping themselves. And then making sure I have bandages, tweezers, and just routine things that I can quickly take care of a wound or something to make sure that it's getting healed.
I want to go back to something you mentioned, having antibiotics on hand, because they can be hard to get if you're traveling somewhere else. How do you get antibiotics if you do not have a prescription or have an ailment from your doctor?
Yeah, so that's a really great question because oftentimes, especially when you're traveling abroad, it can be really hard to navigate the healthcare system. There are some places where you don't even need a prescription. You go to a pharmacy, talk to a pharmacist, tell them your symptoms, and they'll actually give you something right offhand. I've actually had that happen in some places that we've traveled to. So important before you travel to think about all these things, to think about where you need to get health care. Where is the nearest hospital, especially if you're someone who's sick and has medical issues. Where are the nearest hospitals to where you're staying? And making sure you understand, like, where can I get my medications if I need them? Where are the pharmacies? Where are the doctors?
I have a lot of work to do, Dr. Dina. You'd be real. I have like skin cream and, eye patches. All right, thank you so much. Appreciate it. We always love to have you on. And, for more information, you can follow Dr. Dina for more health information on Twitter or Instagram at Dr._Dina.